Hello, one and all. Welcome to me, Gordon Causey, Gordy Canuck. I'm going to talk tonight about monkeypox. If my dog will calm down and not stop barking at every person who goes walking down the street, especially if they have a dog. Come here, Candy. Come here. Come. Very obedient. They say that border collies are the smartest dogs. There she goes. Come here. Come here. Come up. Come here. Come here. Come say hi. Come on. Everyone can hear you. You might as well let them see you. Come here. Up. There you go. There she is. Annoying dog sometimes, but amazing company. Anyway, ignore the dog and talk about monkeypox. You probably, if you're watching this, you probably already know, but if you don't, there's a meeting happening next week with the World Health Organization. And I'm going to read directly from a news story that was published yesterday on June 14th at 11:29 a.m. Eastern Time. The World Health Organization will convene an emergency committee on Thursday next week to assess whether the monkeypox outbreak represents a public health emergency of international concern. PHEIC. They have an acronym for it, of course. And there are obviously only two possible outcomes. Either they do declare it a public health emergency of international concern, or they don't. And then from that, spiderwebs out all manner of possibilities. My own personal opinion is I consider it very likely that they're going to declare it a public health emergency of international concern. And this being the COVID era, we have some context fairly recent. I had to go back and check this. I wasn't aware of it. It was back on January 30th of 2020 that COVID was first declared a public health emergency of international concern. Saying those words far too many times. That was January 30th of 2020. And we all know what happened after that. That basically slipped by my radar. I knew that COVID reporting was coming out of Italy and other places, obviously Wuhan, China. But it was on January 30th when the WHO, the World Health Organization, first gave it that designation. And if you'll remember, the actual pandemic wasn't declared for another 4 or 5 weeks after that January 30th date. And COVID was declared a pandemic on March 11th. And then we all know what happened about a week after that. Basically, the world shut down. And is there the potential for history to repeat? And I think it would be naive to ignore the possibility. So if next week on the 23rd, which I guess is next Thursday, if they come out and declare monkeypox a public health emergency internationally, what does that mean? Will lockdown measures, will it follow the same pattern? Are we going to see lockdown style measures brought in again? I don't think so. For a number of reasons. One of them being that the news, that the way it's being reported is that monkeypox is, it's being presented, I believe, as being less serious than COVID. And I question that because We're seeing reports citing a fatality rate for monkeypox of somewhere between 3 and 6% is the number I saw most recently. I've also seen it quoted as 1 to 10%. So you get infected with monkeypox, that is suggesting that there is a 1 to 10 or a 3 to 6% chance of it being fatal. How does that compare with COVID? I don't know how that lines up with COVID. When it comes to the fatality rate for COVID, the numbers are all over the place depending on who you talk to. I have my own opinion, my own guess, but not being an expert, not having any degrees in virology or infectious disease or epidemiology or any other ology for that matter, I have to defer to the experts. But the problem is the experts. Some suggest it's high. Experts suggest it's less than 1%. So leaving that aside, what happens if COVID is declared a public health emergency of international concern? What I strongly think would happen or will happen if that designation is assigned to monkeypox, what I think you will see right now, there are a lot of people who have been, for lack of a better word, traumatized by COVID. You see it. People are still going outside, even outside, out in the great outdoors, wearing masks. And quite frankly, I think those of that mindset who are still so afraid of COVID that they're wearing masks even outdoors. In Ontario, where I live, Ontario, Canada, my Green Bay Packers sweater that I'm wearing, notwithstanding I'm in Ontario, Canada. In Ontario, public masking mandates have pretty much ended. There are specific locations. I believe that, some doctors' offices, some dentists, things of that nature, some are still requiring masking, but generally speaking, you can go to the grocery store, to the mall, to the movies, restaurant, maskless, and it's not an issue. But in my little town, I would put, if you go to the grocery store, I would put the mask wearing behavior at about 50%. And it's not age dependent either. I would say that of the people going into the grocery store, if they're 60 years of age and up, half of them are wearing masks. If they're the 20 to 30-year-olds, I'd say roughly half are wearing masks. So at this point, I think anyone who's still wearing a mask, even with all the mandates and requirements lifted, I tend to think we're looking at individuals who will never take a mask off. Because COVID or not, simple fact of the matter is that pathogens, bacterial infections, germs, have always been around and they always will be. There's always the potential for danger. And I'm not going to suggest that everyone has different levels of risk tolerance. Some will not accept any risk whatsoever. They want to control everything. Others are more sanguine about it. And, the world is a dangerous place. And I fall into that camp. So what happens if a public health emergency is declared? I think what you would see is an element, a segment of the population that will be screaming for lockdown style measures if a public health emergency is declared. I've got my first engagement. The Hot Mess Mom is writing. They are pushing a new booster for COVID. Also, I read that they already have 1 million doses of monkeypox vaccines. What little I know of the monkeypox vaccine, I've done some reading on it, is that it's an older platform, and apparently it punctures the skin. It's not delivered through a hypodermic. It's not delivered through a needle the way most traditional inoculations are, but something that basically pierces your skin 6 or 7 times and introduces smallpox to your system. I don't believe it's live virus, and I also don't believe it's deactivated either. I'm not entirely certain of the mechanism of action, as they call it, the MOA. But from what I understand happens is that it causes a localized reaction, and that monkeypox or smallpox type sores actually develop at the site where the injection takes place, these 6 or 7 pokes, and that it scabs over, and then eventually the scabs fall off. And apparently, now there was an article in the Atlantic, which I consider a reputable, a well-regarded scientific publication, and they used the term gnarly, as in nasty. Gnarly can kind of have, for those who remember the Valley Girl days, gnarly can have 2 connotations. In the same way, bad, that's a bad dude, or, you know. But the context in which they were using gnarly in this Atlantic article was to suggest that it was nasty and that you wouldn't necessarily want it. And these are, from what I understand, these are vaccines designed for smallpox, which we're told that because it is in the same, smallpox and monkeypox are in the same family, that it has a degree of efficacy. Even though it's not monkeypox, it has, I think, I believe I saw the figure 85% effective or something like that, which to my way of thinking, I mean, we all went through what they said about the other jabs and how they were 95% effective, and then it just spiraled downward from there. But what I think, you know, the immediate, if on Thursday of next week, public health, if the World Health Organization declares monkeypox a public health emergency internationally, we're going to see people screaming. Some, not everyone. I won't be. But there will be some who will be screaming for a return to mask mandates, you know, broad mask mandates, a return to perhaps even lockdown measures and stuff like that. But personally, I don't think we'll see that. But here's the important element. The important element in this is that looking back at the COVID era, prior to January 30th of 2020, when COVID was declared a public health emergency of international concern, prior to that, the degree of testing was much lower. Once that public health emergency had been declared, then the level of testing ramped up substantially. And obviously, with more testing came the identification of more cases. And I can see history repeating itself in that respect. I can see a public health emergency declaration by the World Health Organization being used as justification by health agencies in countries like Canada and the United States to ramp up testing. You ramp up testing, and I would expect them to identify more cases. I believe, I'm guessing here, not an expert, but I'm guessing right now that currently in a country like Canada, if someone goes to the doctor or the hospital and they're presenting symptoms which suggest monkeypox, that then they are doing a test. I don't know whether it's a blood sample or what exactly is being tested, but I believe that those, I'm guessing that those materials, whatever is being tested, are then sent to Winnipeg, where there's our national lab on things like infectious diseases, and there's quite a lag. Now, right now, when I first started really paying attention, I would say mid to late May, I recall the number of worldwide cases being identified as somewhere of 550. Now we're January 15th, January 16th, and the number has climbed up to 1,800. But again, that's with a very low level of testing. If you declare a public health emergency of international concern, then I guess, that the level of testing will significantly increase, and more tests done, more cases, and then we'll see where things go. And again, when it was COVID, January 30th was the day World Health declared COVID a public health emergency. Then it wasn't until 4 or 5 weeks after that, on the 11th, after having ramped up the testing, then they declared an actual pandemic. And then within days, a week of the pandemic being declared, then we were hit with these never before heard of or attempted before lockdown style measures. That I can see, that's where I can see history repeating itself. Now, the hot mess mom is asking, so do you think we would have a smallpox outbreak if we had a monkeypox rollout? A lot of the youngest generation do not have basic vaccines such as smallpox. What the hot mess mom is referring to is those of us, and I'm included in this demographic, I think it was the early 1970s, 71, 72, somewhere around there, that immunization against smallpox as being standard, de rigueur, everyone gets it, that ended sometime around 71, 72. And what they're saying in the legacy mainstream media is that anyone over 50, roughly, or older, that we would have been inoculated against smallpox, but that those younger than 50 received no inoculations against it. So I have an opinion, but it's difficult to express because I'm not a medical expert. So this is a guess. But my suspicion, or my guess, is that those who are most likely to be prone to getting infected, getting sick with monkeypox, would be those who have had a certain type of other injection. More recent, may have had 3 or 4 of them. Now, the hot mess mom is writing GTA, which if the hot mess mom is Canadian, GTA typically refers to Greater Toronto Area. GTA has a basic vaccine rate 28% in their schools. I used to help out at vaccine prior to COVID. I would find that figure incredibly low. I believe, the number of kids who are going to school who have not had their MMR, their polio, and all the standard shots that kids get now. I think there's even one for chicken pox, which, if you think about it, I was reading a book to my youngest child a year or so ago, a book called The Great Brain, which is set in the late 1800s in the American West during somewhat pioneer days. And in that book, diseases like measles and mumps were called and considered childhood diseases that everyone got. And in the book we were reading, there were 3 boys, and one came down with measles. And so it was standard operating procedure in this book, which was something of a biographical account of a young boy who had grown up in the American West. His mother then put the 3 boys in bed together put them in the parents' bedroom and took the infected child and had the infected child share the bed with the two uninfected children to get it over with, to have them all get sick at the same time and then to be done with it. That was a form, I would suggest that was the form of vaccination that they used. Exposure and then recovery. I saw an interview with Anthony Fauci from a number of years ago in which he was being interviewed about someone who had the flu, and the media personality was asking Fauci whether or not this individual needed to get the flu shot. And Fauci, during this interview, was very clear. He was very specific in saying that if that individual had the flu, if it was in fact the flu, then that individual did not need the flu shot, because they had already received the best form of vaccination in terms of prior infection. Hot Mess Mom is writing more. Looks like we must live relatively close to each other, because she's citing Northumberland County has a 92% vaccination rate. I think that's roughly where the numbers are. And I think that's 92% of individuals aged 5 and up or 12 and up, but I think it's 5 and up. And she's saying that you're right, the GTA has the lowest rate in Ontario. I don't know if that's true or not. I don't know what the GTA's, Greater Toronto Area's, rate is for the COVID shots, but I would assume it's very, very high. A story came out, a friend of mine who I've talked about before is Pastor Henry Hildebrandt from Aylmer, Ontario, something of a known personality. He's out in Aylmer, Ontario, which is part of, I'm trying to remember, Malahide, I think is the name of the township, Malahide Township. And CBC actually did a story on them and taking note of the fact that Malahide Township, that postal code district, had the lowest rate of vaccination in Ontario, or if not the lowest, certainly one of the lowest. And at the time it was hovering somewhere around, this was back last summer, I think, it was hovering somewhere around 50%, give or take. Okay, the Hot Mess Mom is adding, she was talking about vaccination rate being all vaccines, not specifically the COVID shot. So I don't know. That's beyond what I've read up on. Quite honestly, prior to the madness of the past 2 years, I never gave any of this much thought. But like a lot of people during this COVID era, certainly at the beginning when everyone was locked down, stay home, stay safe, what else are you going to do? You start reading, researching, hearing all the varying opinions, listening to all the experts on all different sides to try and sort your way through it. Anyone who knows science knows that consensus can be incredibly elusive. Opinions vary and can be opposed. You can have a highly accredited expert. You can have a Nobel Prize winner who disagrees with what public health says, and who's right, with a public health official. Now, who's right, the Nobel Prize winner or the public health official? You don't know. I don't know. So my attitude was I would listen to both. I'd listen to the Nobel Prize winner, I'd listen to the public health, and then I'd measure it off against my own observations, what I'm seeing directly firsthand, and then reach my own conclusions, my own opinions, but always being cognizant that things can change. My opinions can change. My opinions have changed over the course of this 2-year period that we've been living under. But my concern is that with monkeypox, I believe they're going to declare it a public health emergency of international concern. If they declare it's not, that will surprise me. And the thing is, if they say no, it's not a public health concern, PHECIC, or public health emergency, that was the term. I'll look it up again. Public health emergency of international concern. If they declare it, if they don't declare it, if they say it is not a public health emergency internationally, then I don't see how they can conceivably come back in a week, in a month, in 2 months, in 3 months, and later say, okay, now it is. Because that would be an acknowledgement, I would say, that they got it wrong. If it's an emergency, it's like, picture it this way. There's a small fire happening in a woodlot, in a wooded area, and it's only a small little fire. And so fire officials come, they say, well, this isn't a concern. And they wait until it blows up, until wind comes along and pushes the fire out. And then they say, okay, now it's an emergency. Well, if you'd said it previously, frankly, I already said it once. I'm going to say it again. I only think it will be an emergency for a specific percentage of the population. And I would say cryptically that 90-ish% of the population aged 5 and up. And we'll see how things play out. I'll probably do another video. This has gone on long enough, almost 30 minutes. But I'll probably do another one of these next week once we get a definitive answer, which, again, my guess is that they will, yes, say this is a public health emergency. And then I expect that testing will ramp up. Right now, the number of cases, according to the most up-to-date numbers I've seen, are 1,800, over 1,800 globally. But that's with what I view as probably very low-level testing right now, where people go to the hospital or to a healthcare provider, their doctor, presenting symptoms, and then testing takes place. I don't think it's the same testing that they used for COVID. I don't think it's a PCR test. But as I understand it, from what I've read, they can calibrate, they can make the PCR test specific to any virus, be it COVID, monkeypox, or I imagine any number of others. So what happens? I'm not going to stay safe. I will say stay well. God bless. And interesting times. Not the greatest video, but